Everybody, and welcome to our special mini training entitled Contraceptive Use During Perimenopause and Midlife. Welcome, thank you for joining me today. I'm just going to do a couple of technical checks before we get started to make sure that you can actually see me and hear me. So give me a moment. I'm going to wait while everyone else joins. But let me just check that you can all hear me and see me, and it looks like you can. So yes. Give me a moment. Yes. Okay. Well, welcome everyone. I am super excited about this mini training today because it is a topic that I have been asked about tons and tons of times about from women, midlife women, anywhere 42 plus, 45, as they're getting closer to knowing that they're in perimenopause or assuming they're perimenopausal or are beginning to have symptoms and can feel that something is changing in their body. They want to know about what to do with their contraceptive method. Do they still need it? Should I be changing it? Is it still relevant? What if I want to also be on HRT? Do I, if I'm perimenopausal, can I even still get pregnant? So all these different topics we're going to be looking at today. And while I am online with you chatting and talking, please ask your questions. If you don't want to ask your questions in this safe space but yet public forum, then please feel free to message me. You can DM me in Facebook Messenger, go to Jacqueline Gray Rose profile and it will come up immediately. I have all my screens here so I can see anyone that is messaging me, anyone that wants to ask a question. You can either do it in the comments on this video, or you can, as I said, come in and private message me. So if I'm not looking directly at the screen, it's purely because I'm looking at other windows or other devices to see if there are any comments or any questions that are being asked. So please feel free to ask, feel free to interact with me. Again, if I'm not looking directly at you, it's purely because I'm looking at other windows or other screens or looking to see if people are asking questions. So I think we're going to get started. We have a lot to cover today. I'm going to relate to questions that women regularly ask me, the general sort of biology and hormonal health that you need to know, your options that are available, and we're sort of going to go from there and see how we go. So let's start with the first thing. Before we even reach perimenopause or menopause, we use different contraceptive methods to prevent pregnancy. That is the main reason for using contraceptive methods. Our contraceptive methods available are either the pill of the various different natures, diaphragm, or Mirena. There is also the patch or the NuvaRing, which are similar to the pill because they are hormonally based contraceptives that affect the hormonal balance or changes the reproductive hormone levels so that you don't get pregnant. Those hormonally based pill, patch, NuvaRing can either be, continual use. Sometimes that we will double pack so that you don't have a bleed. Sometimes they are cyclical. Sometimes, for example, like with the patch, it can be for 3 months and then you have to have another one. But they are all hormonally based, where we are altering our natural hormonal balance to ensure that pregnancy doesn't happen. The pill or any of those other pill-like alternatives can also be used, are also recommended for treating PMS, irregular periods, or other symptoms related to often fertility or some type of hormonal imbalance or some type of reproductive or PMS or period related pathology, challenge, concern. Then you have the diaphragm, which is an absolutely non-hormonal method, and it is used as per needed. Then you have the interutinary device, which is the IUD, which can either be a copper IUD, which is totally non-hormonal, or the Mirena IUD, which releases low localized progesterone levels. I think that's what we have. There is also, there are a couple of others, but those are the main common ones. And you choose those as per your choice, as per your doctor's guidance. What I want to start off by saying is that there are other ways to prevent getting pregnant. For example, the fertility awareness method, really keeping track of your cycle, which works very well if you have a very predictable, very regular cycle. But at the moment, we're looking at the non-biological or non-in tune with your natural biology options. Every contraceptive method has pros and cons, and I am not here to advocate one or the other, but please be aware there is no perfect contraceptive method. Everything has a pro and a con. There is a lot of research coming out, and a lot of research that is not talked about when you go to ask your doctor about the pill, about the impacts and side effects of using the pill. Now, the pill is not a one-size-fits-all pill. There are obviously different brands, different types, different dosages, whether it's estrogen or estrogen and progesterone, whether, there are a lot of different types depending on what country you live in, what is available to you. We are an international group here, so I don't want to talk about specific brands because different women in different countries have different accessibility to different brands and different types. So, in general, however, the pill is a hormonally altering option. It can come with side effects. It has been researched and reported of potential side effects for women. Dangerous mood swings in terms of feeling really depressed, heavy anxiety, physical side effects, pain, even though the pill is often used to treat PMS. Please be aware that the pill in of itself can have side effects, and remember that the pill itself is altering your natural hormonal cycle. So the bleed, the period you have when you take the pill, is not a biological, natural hormonal bleed. It is a bleed of cessation of the pill. So just be aware of that as we go into our conversations later. Again, diaphragm is a great option because it is totally non-hormonal, but many women don't feel comfortable using it. Many women don't feel that it is appropriate for their sex life. Whatever it is, diaphragm is great, but plenty of women don't like it, don't feel comfortable with it, don't enjoy sex when they have it. I'm talking about, obviously I should have said at the very beginning, female use of contraceptives. There are obviously male contraceptive options, but here we're looking at female contraceptive use. Copper IUD is an excellent form of contraceptive if you, again, don't respond badly to it. The reason why it's a great form of a great contraceptive is because it lets your natural hormonal cycle happen. It just prevents implantation of the egg, of a fertilized egg in the uterus. So you will still have a bleed, a monthly bleed with your copper IUD, but I've heard also women experiencing side effects with their copper IUD. So again, you've got to know your pros and cons and see what works for you. Then you have the Mirena IUD. The Mirena IUD is similar to the regular IUD, except it is hormonal. It is producing, releasing those low levels of progesterone, and it is a great way. Now I'm getting confused if it's producing the estrogen or progesterone. I will check with that. But it's producing the low-level hormones in the uterus, so it is a great way of many women, it's an extra barrier against pregnancy. You've got the IUD plus you've got the extra hormonal release, so it's an extra barrier against pregnancy. But again, there are some women who don't enjoy it. There are some women who spot with it. They have spotting. There are some women who have no bleed at all. There are some women who sense that, because you are still cycling, you are still releasing an egg. It's just preventing pregnancy and implantation. So you are still cycling. So your hormone cycles are not impacted. They are, it is still happening, but it is happening. So from that perspective, it's great. But there are women who doesn't agree with, who it doesn't agree with. So I just want to check, because I want to make sure I'm giving you the correct information, because I just got a little bit now unsure with myself as to whether it's releasing estrogen or progesterone. But I will come back and I will let you know. Okay, I will confirm with you. I had a bit of a brain freeze with respect to that. So those are your options available. That is what there is. And as you've understood, that if you don't want to get pregnant, you will need to use one of these alternatives. Again, you can use a male contraceptive alternative. You can also use a fertility awareness method alternative. All of that is legitimate. No judgment. No, I'm not giving any of you any of my opinions on all of this. I'm just letting you know the options and the pros and cons that you should be aware of when you have the conversation with your doctor about what you want to use after you have decided that you want to stop having children. Remember, and this is one of the most important things that I want to tell you, because this is what I get asked about repeatedly from women when I do workshops. The question is, I'm 47, 48, 49. I'm late perimenopausal. I'm almost in menopause. I'm experiencing perimenopause. I've got the symptoms. Even if you're on your contraceptive methodology, you will still, your methods, your options, you will still experience menopause, perimenopause. You will still, your hormones are still going through their natural changes. You will still experience symptoms. You will still be going through perimenopause even when you are on your contraceptive method, even if you are not having visible period signs, or even if you are using that contraceptive not to get pregnant. Your body is still going through the natural biological changes of its hormonal fluctuations leading into perimenopause. You will still be experiencing your menopause symptoms. So therefore, I get asked repeatedly, my gynecologist has said to me, because I am in, late perimenopause or heading into menopause, my periods are quite infrequent, if you even know when your period cycles are, because as we said, if you're on a contraceptive device, you may not know your natural period cycles. But whereas the doctor is assuming that, I can probably stop my contraceptive use. I probably don't need to use any contraceptive now, because I will probably, the likelihood, my gynecologist said to me, the likelihood of me getting pregnant is probably really very low or non-existent or irrelevant. I want to make this very clear to everyone. As long as you are ovulating, even if you are ovulating irregularly, and especially if you are ovulating irregularly, you can still biologically become pregnant if you are having sex. That means it doesn't matter if you have irregular periods. It doesn't matter if you are near to menopause. Biologically, as long as you are ovulating and releasing an egg, you can potentially still get pregnant. Two caveats. The first one is the increased risk of getting pregnant, because if you are having irregular periods, you don't know when you are ovulating, and therefore anytime you could be having sex, you could be ovulating, and therefore you could get pregnant. However, and I will add this very clearly, that the likelihood of you getting pregnant is low. Egg quality, reproductive environment, quality of the uterus to absorb a pregnancy, all of these things, yes, have declined, have reduced, and the possibility of you getting pregnant may be very much reduced compared to when you were 25, for sure. But is it impossible? Absolutely not. When does it become impossible for you to get pregnant? When you are in full-blown menopause, and that means 12 period-free months. Until then, the chance is always there. The biological possibility is always there. Is it likely? Maybe not. But I'm asking you if you want to take that risk. Some women may be happy to take that risk of having unprotected sex at the age of 48, 49. Other women may not. But let me just tell you, if your doctor, and I have heard this repeatedly, your doctor, your gynecologist tells you you cannot get pregnant, please go find yourself another gynecologist, because they are not behaving in a responsible manner. The likelihood may be very, very low, but is it impossible? Absolutely not. Okay, so what happens then when we enter perimenopause? How does this conversation around contraceptive use become more complicated when we enter perimenopause? So there are a couple of things that you may want to be thinking about. The first thing is, you may want to know at the age of 44, 45, 46, 47, anywhere in your 40s, where am I on my perimenopause journey? I'm beginning to notice changes. I can feel things are happening. I can feel that I am beginning to experience some menopause symptoms. But if you are taking any type of hormonal contraceptive, you will not be able to know where you are on your perimenopause journey, because any blood test will be inaccurate because you are using a hormonally based contraceptive. And secondly, you're not having a regular period, so you don't know how your period frequency and flow have changed. You don't know if your frequency is if it's getting further apart, if you've got 3 or 4 periods and then you've got 6 months of a break. You don't know if it's lighter or heavier or what's happening. So all of these natural changes, and to be able to assess where you are on your perimenopause journey when you are taking the pill, is very, very difficult to do. So sometimes you're recommended come off your hormonal contraceptive for a few months so that we can let the hormones come out of your body, and then we can see where you are. Great. But you still are going to need to use a contraceptive if you are having sex with your partner. So whilst it may be totally fine that, good advice to come off the pill, the NuvaRing, the patch while you are in perimenopause, because your gynecologist or doctor wants to check your hormone levels, wants to check, see how your periods are doing, wants to check your menopause symptoms, all those types of things. Or you may feel, I want to get more in touch with my body. I want to know what's going on. I want to figure out where I am. Great, come off it. I absolutely promote women getting off hormonal contraceptives if they can. But then be aware that you are then, if you are having sex, you are having unprotected sex, and the possibility of you getting pregnant is there, and is very, very much there. Even if you are 49 or 50, until you know that you are in full-blown menopause, coming off your contraceptive method leaves you at risk of potentially getting pregnant. So yes, come off what you need to come off, but be aware, coming off is important to check and to see, but be aware, as we've said, your risk factors. If you are using a diaphragm, you have no problem, continue using it. You can obviously be very in touch and see and monitor and check, you have no problem. What happens with the IUD option? So the IUD is slightly more challenging because you can't obviously take the IUD out for a month or two and see what's going on and then have it put back in. Usually when you have an IUD, whether it's the copper or the Mirena, you have it for about 5 years. And if you are having the copper IUD, you can monitor if the copper IUD has been successful for you. You are able to check and monitor. You can have hormonal testing. All of that is fine. With the Mirena IUD, again, you may not be able to see or to feel your cycling, so you may not be able to understand where you are. You can do hormone testing. The hormone that is released by the Mirena is localized. It stays in your uterus. It is not all over your body. So having hormone testing can be helpful to see where you are on your menopause journey. And some gynecologists and some doctors say that if your Mirena is about to come out, if your IUD is about to come out, as you're getting, your 5 years is ending at around the age of 50, some say you can leave it in for another couple of years, up to about 7 years, until you are better into your, into more sort of in your early 50s where you are closer to post-menopause or menopause, and where taking out the IUD at that stage is less of a risk, and then maybe you can use an alternative contraceptive as you're trying to identify where you are on your menopause journey. There are a couple of issues here that I want to relate to that women ask me about. The first one is about using a contraceptive as an HRT alternative, or what if you choose to use HRT to manage your menopause symptoms. So your contraceptive pill specifically is not really, can be an HRT alternative depending on, is it boosting your estrogen? Let's start with this, what your hormones within the pill that you are taking. Is it estrogen only? Is it progesterone and estrogen? Are you taking it continuous? Is there a break? Just like the pill, HRT is not a one size fits all. You can go back and listen to the HRT training that I did last month to hear all about the HRT conversation. HRT cannot necessarily be used as a contraceptive method. The pill potentially could be used as an HRT boost, depending on what you need, what's going on, what symptoms you are experiencing. Again, these are conversations you need to have with someone who understands what they are talking about, whether it be me as a menopause coach or a very well-informed gynecologist, or anyone who, other menopause specialists, someone who understands what is going on with your hormones, how to monitor and see what different hormones you need, how the different hormones relate to treating the different symptoms. Depending on the symptoms, you may need different hormonal combinations. Again, either whether it be through the pill or through some type of HRT use. That is a discussion that is very personalized, very unique to the woman that is in front of me, and super happy to have more in-depth conversations with anyone who wants to really understand what their options are with regards to stopping the pill, using HRT, what dosages, and also that's the other thing, is that the dosage is not the same depending on, again, what your symptoms are, how extreme your symptoms are, what type of hormonal support you need. The dosage is also very different. You may need a higher estrogen dose, a lower progesterone dose. You may also need some testosterone, which is not obviously for pregnancy prevention, but is an HRT option. So, and different pill, the NuvaRing, the Eva Patch, and the different pill products have different dosage combinations. So I know, for example, I just want to check my notes here, that the Evra Patch has a very high estrogen estradiol dosage, whereas the NuvaRing has a low estradiol dosage. So again, depending on what's happening, what you need, what your symptoms are, where you are along your journey, how old you are. The different hormonal pill-like contraceptives, you may need to change between them, or you may prefer one to the other. If, for example, you're coming closer into menopause, you may opt for one or the other, depending on where your hormone levels are, what hormone support you need. So these are all conversations that at the moment I want you to be aware of, to have that knowledge, to have that information, to know that these are conversations you need to have with someone who knows what they are talking about. I'm also just looking at some other notes to see if there's anything else I want to add about those, the NuvaRing, the Evra patch, and the regular pill, with the very big awareness that different so as I had thought, the Mirena releases progesterone, okay? The Mirena releases progesterone, so you may need, so we're talking about the pill. Diaphragm, you don't need to worry about. Copper IUD, you may need some extra hormonal support with the copper IUD because there is no hormones in the copper IUD. So therefore, if you are in perimenopause and you experiencing symptoms, it is a form of contraceptive, but it's not a form of hormonal support. And when it comes to the Mirena IUD, you are getting those low doses of progesterone. So you will not be getting pregnant, please God, if you don't want to get pregnant using the Mirena IUD. But if you need extra hormonal support during that time, because you are going through, you are experiencing menopause symptoms, so you will only need to potentially have an estrogen support or a testosterone support because you are already getting the progesterone support through the Mirena. So again, these conversations of if I'm on a contraceptive device and I want to be on HRT, what do I need? Or can my contraceptive device act as an HRT supplement? Yes and no, depending on what your specific needs are and what form of contraceptive you're on. And the other thing that I get asked about is spotting. And this is something that women absolutely struggle with during this time. So let's break it down. The first thing is, remember, as you are in perimenopause, and if you are able to track your natural hormonal cycle and your natural menstrual cycle, things are going to be changing. Heavier periods, lighter periods, closer together, further apart. And spotting is a normal and natural part of that process. You may have spotting in the days leading up to a period. You may have spotting as your period is ending. None of that is unusual, with two caveats. The first one is always go get it checked out. Unusual bleeding should always be checked out, especially in perimenopause when there is unusual bleeding or especially heavy periods or bleeding, breakthrough bleeding. It could be because of fibroids or cysts or an extra thickening of the endometrial lining, the uterine wall lining. So I recommend every single woman to always get it checked out. Assuming everything is okay, assuming there are no fibroids, no cysts, and no excess endometrial lining, the natural breakthrough bleeding or spotting happens. And why does it happen? It happens because of the estrogen progesterone fluctuation. These hormones are now not working in the nice, predictable cycle that they were working in during our fertility years. Sometimes estrogen is super higher than progesterone. Sometimes progesterone is higher than it was meant to be. It's all not about objective numbers. It's about subjective relative levels, depending where you are on your cycle. And obviously, as our cycles expand and extend and grow, which is what they're meant to do, our periods are meant to get further apart. The hormone levels and the breakthrough bleeding and the spotting potentially can increase. That is not an unusual thing to happen. So breakthrough bleeding or spotting in and of itself is not a sign that there is something wrong. It is a normal, natural part of perimenopause, but absolutely go get it checked out. The second caveat is the only time breakthrough bleeding or spotting is always a warning sign of something potentially going on is in postmenopause. In postmenopause, there should never, ever be any bleeding. And if there is bleeding, you need to go immediately to your doctor, okay? So, postmenopause bleeding, absolutely big X, should not be happening. Go get it checked out. Bleeding and spotting in perimenopause, absolutely possible, absolutely normal. Go get it checked out just to rule out any potential issues, but it is fine. I know I have a lot of Jewish women in this group, and for Jewish women, breakthrough bleeding and spotting is a potential challenge. I'm not going to go into depth about that now because I'm hoping to have another conversation specifically related to Jewish women and family purity and spotting and bleeding in perimenopause. So I'm not going to relate to that now. What I do want to say, however, is that for any woman, breakthrough bleeding and spotting can be annoying, and it can be a pain, and it can be unpredictable. It should never be gushing, and if it is gushing, go to the doctor. It should never be something that prevents you or limits you from daily function, and if it is, go to see your doctor. And the other thing is, if you are coming off your contraceptive device, if you are starting any type of HRT, there may be breakthrough bleeding and spotting during that time also, because you are removing or adding hormones to your hormonal cycle, and it may take a while for things to balance out. So especially if you are coming off your contraceptive device or the pill or whatever it is you're using, there may be some time period of adjustment. Your hormones are going to need some time to readjust. So there may be some spotting during that time. And also, as you start HRT, there may be some spotting at the beginning of that journey, of that process, as your hormones settle down. And again, all of that is normal. You should always go get it checked out, but 99% of the time, it is normal, natural hormonal fluctuations that are triggering the spotting or some type of breakthrough bleeding. Let me see what else I wanted to cover today. I think we've covered a lot, a huge amount. I'm going to open up for questions. I'm going to give some time to see if there are any questions. So let me see if anyone has asked anything in the meantime while I've been talking away. Let me see if anyone is asking anything. Let me have a look. There was one specific question that was asked about the Evra patch. Okay, so again, the question about the Evra patch was related to some people say we should stop using it. And this relates back to what I said earlier. Should you stop using your contraceptive methodology? Yes, absolutely. And you should give your body time to readjust, and you should give your body time, especially if you're in your late 40s or early 50s. Absolutely, we want to know what is going on in our bodies, as I said earlier. But remember that even if you are 50, even if you are 51, if you are not in full menopause, 12 period free months, the chances of you getting pregnant exist. And even if your gynecologist says there is no way you're going to get pregnant, if you are ovulating, you will still get pregnant. The other thing I want to bring up, and I mentioned this a bit earlier, the chance of you getting pregnant may be very, very low. The chances of you ovulating, having sex at that time, and the fertilization process happening is absolutely possible. The chance that the pregnancy will take may be very low. The chance that, God forbid, you may have an ectopic pregnancy is high. The chance you may have some complications in the earlier stages of a potential pregnancy are high. The chances of it going to a full-term pregnancy are low. You have to make the decision for yourself with your partner, with your doctor. What are my risks? Do I want to be exposed to those risks? Do I want to go on the emotional journey of wondering, am I going to get pregnant this time? The stress of knowing that I could potentially become pregnant. And it could be a complicated pregnancy because at the age of 50, maybe my body is not meant to hold a pregnancy anymore. These are conversations to be had. They should not be ignored. I'm not scared about bringing them to your attention, even if there are small chances, because I honestly believe that as women, we need to be informed and empowered about what is going on in our body and not just rely on the doctor saying, the chances of it are very low. It's probably very unlikely. It's not going to happen. We know that these things do happen. We know they can happen, even if it's a small percentage. And I want you to be aware of all the pros and cons, of all the risks and benefits, of all the things going on in your body so that you can be empowered when you sit in front of your healthcare professional to be able to ask the questions that need to be asked. So I hope I've made that clear. I hope I've really brought that issue into a clarity for you. Okay. So what have we discussed today? We have looked at contraceptive methods in general. We've looked at some of the pros and cons, or being aware there are pros and cons of different contraceptive methods. We have looked into how contraceptive method use can be impacted by perimenopause. Remember, it depends on what method you're using, what your specific symptoms are, knowing that if you are on the pill, the NuvaRing, the Evra patch, or any type of hormonal contraceptive, you will not be able to do blood tests to become aware of where you are in your menopause journey, and you will not be able to know directly what is going on with your period cycling, because these hormonal options interrupt the natural hormonal cycle. We have talked about what happens if you want to come off contraceptive devices or usage during perimenopause, the pros and cons, the risks and the benefits. We have talked about contraceptive use and HRT use, how they sort of work together. Can they work together? Remembering that HRT is a hormonal support during perimenopause to help treat your menopause symptoms. It is not a pregnancy preventative. But contraceptive use could be potentially used as in conjunction with some type of menopause management for HRT, as an HRT option, depending on the symptoms, depending on the type of contraceptive you're using, depending on the dosage of what you're on, depending on if you need extra support. We have talked about spotting, bleeding, breakthrough bleeding. The one last thing, which I think I mentioned, is that eventually when we do come off our contraceptive, whatever that is, be aware it can take your body a little bit of time to readjust. Okay, so if you are using a copper IUD, you will probably have less of an adjustment, although you may have some abdominal pain for a while. When you take out any of the IUDs, you may have some abdominal pain for a while. You may have some bleeding for a few days, but your body should return fairly quickly to its natural cycling. But when you stop any of the hormonal contraceptives, it may take a while for your body to readjust. So you want to wait some time to do any type of hormonal testing, and you want to wait some time to let your system get back into flow, to see what's going on with your period, to see where your hormones are. Okay. I hope that has been super informative. Again, if you have any questions, you can either pop them in the comments of this video, or you can direct message me in Facebook Messenger at Jacqueline Gray Rose. Please feel free to reach out to me. If you want further individualized support, you can book a one-to-one menopause consultation session with me where we can go through your own unique specific situation to assess what your needs are. And I hope you have enjoyed this. I hope that this has now helped you as you navigate these years to make more informed decisions, to ask better questions from your medical health care practitioners, and to really have the tools to navigate menopause journey with ease, joy, and confidence. Have a fantastic day. See you all soon.